cortex, or from the cortex go to the spinal cord or another part of the brain. Two ways connection, ascending descending connection of the brainstem with the cortex, spinal cord with the cortex. It is called projection fibers, and these projection fibers pass through this narrow part of the white matter. Association fibers pass here, projection fibers pass through the capsula interna.
Only this part?
Only this part for projection fibers, only this.
Okay.
Under the corpus callosum in hemisphere lies another structure which is called fornix. This structure, fornix. Some part of fornix, it is not completely, this fornix. It starts from two columnar fornices. Some part of fornix here you can see. This is columnar fornices, two columnar, which start from the mammillary bodies, this mammillary body. From this mammillary body start columna. Then they form corpus fornices. This is corpus fornix, corpus fornices. And then crura fornices. Crura fornices each goes to the temporal lobe and ended by hippocampus. This old part of the brain is hippocampus. Hippocampus. Fornix here you can see only some part of the fornix. Where is located? Under the corpus callosum. This is columna. It starts from mammillary body. Here fornix goes. It is fornix, fornix, fornix. But then it goes to the temporal lobe. That is why on sagittal section you could not see this crura fornices and hippocampus. On the sagittal section, this part is not visible. It goes to the temporal lobe. This fornix, corpus callosum, and between fornix and corpus callosum lies this lamina of the gray matter, which belong to olfactory brain. It is called transparent lamina, in Latin, septum pellucidum. It is very thin. One is lies from this side. This is septum pellucidum between corpus callosum and fornix. This and this. Two lamina between which lies cavum septi pellucidi between them. It is one side septum pellucidum. And from two columnar fornices between two passes another commissural fibers. They form commissura cerebri anterior, which goes from one fornix to another. Maybe this commissura anterior between two columnar fornices lies. On medial surface you can see sulcus corporis callosum, above of which lies gyrus cinguli. Cinguli, band. This band, cingulum, gyrus cinguli. Gyrus cinguli delimited by sulcus cinguli, which is ended by sulcus terminalis, marginalis. Sulcus cinguli delimited gyrus cinguli. This gyrus cinguli comes and behind splenium form narrow part, isthmus, after which it goes in temporal lobe, forms parahippocampal gyrus, this hippocampus. Gyrus which adjoins to them is called parahippocampal gyrus and uncus. Gyrus parahippocampalis and uncus. Gyrus fornicatus, all this, like fornix, this, like arc shaped. Yeah? It consists of gyrus cinguli, isthmus, gyrus parahippocampalis, uncus. These two parts, parahippocampal and uncus, on medial surface and partly on the inferior surface visible. They are cortical center of distinguishing of smell. We can analyze different type of the smell here. Gyrus parahippocampalis and uncus. This is gyrus fornicatus, which belong to olfactory brain, rhinencephalon, olfactory brain. On medial surface you can see this is gyrus frontalis superior, gyrus frontalis superior and gyrus frontalis medius, this inferior, on medial surface. This is lobulus, gyrus precentralis. This is gyrus postcentralis. Together they form gyrus lobulus paracentralis, paracentral lobe on medial surface. Together, paracentral lobe, motor center. Next part of the brain is called precuneus. This is precuneus, and this is triangular in shape. Cuneus. It is not so typical here. Cuneus. This is precuneus, cuneus, and sulcus calcarinus, which delimited it is the margins of the sulcus calcarinus form. Sulcus calcarinus, it is the primary groove, like parieto occipitalis, sulcus calcarinus, sulcus centralis, sulcus rolandi. Remember these fossils. Sulcus calcarinus center, cortical, visual. Sometimes when hit something, especially in cinema, some cinema use this, loses the visual conscience, could not see. Blindness maybe causes. Blindness maybe depend from the eyeball and optic nerve. It is peripheral blindness. Blindness may be central, cortical. Destroyed this cortical center, we can only here we can analyze all impulses from the eye. If this center is destroyed, peripheral normal, could not see. What center? Visual center. What center? Auditory center. What? Smell, olfactory center. What? Motor. This sensory. Remember this 5. Это вот minimum, obligatory minimum. Motor, sensory, auditory, smell, visual. But also second, specific for the men, speech center, praxis center, the reading center, and so on, different centers. Precuneus, cuneus on medial surface, and at last on inferior surface. Please bring me the skull from the Rabia. What's happened? On inferior surface of the hemisphere. Thank you. On inferior surface of hemisphere, we can see only 3 lobes. What 3 lobes? Frontal, temporal, and occipital. It is not a hemisphere. On inferior, can see only frontal, temporal, and occipital. On frontal inferior surface, sulcus olfactorius. What structure lie here? Bulbus and tractus and trigonum, and then substantia perforata anterior. This is peripheral part of the olfactory brain. The central is gyrus fornicatus. Peripheral is olfactory bulb, tract, and trigonum, and substantia perforata anterior. Sulcus olfactorius and longitudinal groove delimited gyrus rectus. This is called gyrus rectus, the straight. On this bulb, olfactory bulb, through the skull cavity, the upper part of the nasal cavity is sensory. It is olfactory part. Nasal cavity conditionally divided 2 parts. Respiratory upper is olfactory, and here in upper part many olfactory multipolar cells. Their axons form what structure through this? Lamina cribrosa. It has about 15-20 small openings. Pars nervi olfactori. It is not one bundle of nerve like this. It consists of many very thin nerves. They form fili olfactoria. Fili olfactoria. Fili olfactoria form the first pair of the cranial nerve, nervus olfactorius, ended on bulbus olfactorius. After synapses, axon form tractus olfactorius. They form sinus on the cells of trigonum olfactory, and their axons come to the uncus. This olfactory brain has peripheral part and the central part, and cortical center is uncus, highest cortical center. What gyrus is this? Gyrus rectus, sulcus olfactorius. This part of the brain adjoins to what? Lamina orbitalis of the frontal, orbital lamina of the frontal bone of the skull. It has lamina orbitalis. As you remember, inner surface, external surface of lamina is smooth. What fossa here we have? Fossa la glandula lacrimalis. But inner surface of all parts of the brain, they have what? Impressiones digitate and yuga cerebrale. This yuga corresponds to the grooves. These impressions corresponds to the